it is true, there was a communication that was made.
Coronavirus pandemic in the country. Yesterday, we informed you about 14 positive cases that had been recorded at our border point in Namanga, which included 9 Kenyans and 5 Tanzanians. We appreciate the great importance of surveillance at our borders in this war against the coronavirus disease. Today, I have dispatched a high-level delegation from the ministry led by Acting Director General Dr. Patrick Amoth to Kajiado. The team will also pay a visit to the Namanga border to ascertain the measures we need to put in place to curtail cross-border transmission. Today is also an important day of celebration in health the world over. It is the International Day of Nurses. Our nurses have been at the forefront in this fight against coronavirus as the first point of call in our various health facilities. These healthcare workers make tremendous sacrifices every day as they place themselves at the risk of contracting the virus in the call of duty to make sure that those infected are well taken care of so as to make full recovery, to regain their lives, and also reunite with their beloved families. To recognize the wonderful work of nurses around the country, I wish to remind all relevant stakeholders the importance of investing and supporting the nursing profession. I am glad that during this unprecedented pandemic, various stakeholders and well-wishers have come out to support our healthcare workers, our nurses included, in various ways. We are grateful for this support. Under normal circumstances, we would be conducting various activities to celebrate this year's International Nurses Day. However, under the current circumstance of the COVID-19 pandemic, all planned events to celebrate this day have been suspended globally. However, this does not stop us from celebrating the success of our nurses here in the country in word and in expression. It is through their efforts and commitment in conjunction with other healthcare workers that we have managed to record over 200 recoveries since the pandemic struck in the country. So today, we urge all nurses countrywide to keep their candles burning in honor of Florence Nightingale, the founder of the nursing profession. Remember, you are the mouthpiece of those who cannot talk and the light of those who cannot see. On my own behalf, the Ministry of Health and the entire government, I wish to thank all nurses in the country for their commendable work and assure them of our continued support, not only during this coronavirus pandemic, but also in the wider health sector. This pandemic and the response mounted against it has disrupted life and placed people under stressful conditions the world over. It is important, therefore, that we all strive to maintain a level of objectivity and sanity under these very difficult circumstances. Let me now give you the test findings over the last 24 hours. Since our last update yesterday, we have tested 978 samples, out of which 15 have tested positive for coronavirus, Of these 15, 14 are Kenyans, and 1 is a Rwandese national. In terms of age, the range, the youngest one is 1 year and 8 months old, while the oldest is 62 years. 10 are males and 5 are females. 2 other individuals from Tanzania at the Isebania border also tested positive and were referred back to Tanzania. If you recall yesterday, I said that at the border points, we are also testing those Tanzanians who want to cross over, but we are testing them while they are still on their soil and then sharing with them the results of the test. So when they turn out positive, these Tanzanians, because they have trekked through the Tanzanian soil, need to be able to go back for isolation, but also for the contact tracing that the Tanzanian authorities need to do. So when we say that they were tested, I want it to be made clear that they were tested while they were on their soil, on the other side. This number is distributed in the counties as follows. 7 cases are from Mombasa and 3 from Migori, 2 from Wajir and 1 each from Nairobi, Machakos and Kiambu. This brings the total number of those who have tested positive thus far in this country to 715. The spread of the positive cases by estate is as follows. Mombasa, Mvita had 5 cases and 1 each from Jomvu and Kisauni. In Migori, the 3 cases are from Kuria East, in Tebesi and Nyamaranya. In Wajir, the cases are in Gulet Dere in Wajir South and Griftuhaga in Wajir East, West. In Nairobi, the 1 case is from Githurai 44 and in Machakos from Katiani. I would like to report that today we have discharged 8 people from hospital. This now brings to 259 the total number of recoveries from COVID-19. We continue to appreciate and thank our healthcare workers for this great work that they are performing. We are also saddened to announce that we have lost 3 patients in Mombasa. 2 of them died at home, while the 3rd one died in hospital. These deaths bring to 36 the total number of those who have succumbed to the disease. Our heartfelt condolences go to the bereaved families and friends. Thank you. I now want to, you can see I'm joined by PS Ambassador Kamau Macharia of Ministry of Foreign Affairs. I want to invite him to make his remarks.
Thank you very much. As you heard, today is the International Nurses Day, and we in the Ministry of Foreign Affairs have come here to show our solidarity and our support, not only with the nursing profession, which we admire greatly for their sacrifice and their dedication, but also to express our solidarity and our support to the Ministry of Health, a ministry that has led this incredible fight and war against COVID-19. Those of us in the Ministry of Foreign Affairs are very conscious of the fact that this is a global pandemic, and every day we witness global reports from multiple countries around the world. And Kenya's efforts, led by the Ministry of Health, are admired and recognized. we see articles and newspapers in many countries that admire not only the discipline of Kenyan people to adhere to curfews and to other restrictions that have been imposed, but that admire the fact that Kenya took the steps that it did early and did so with determination and commitment. And this was because of the guidance and the professionalism that we have seen from our colleagues in the Ministry of Health, as well as those frontline workers, including the nurses. So the Ministry of Foreign Affairs is here to say a special thank you to the great effort that the Ministry of Health continues to undertake to protect the lives of Kenyans, and the fact that it has done so in a manner in which we as Kenyans have been given international recognition for. So to show that we are truly committed and that we truly admire the work of the Ministry of Health, we have come to give a small token of our appreciation. And today we want to donate. What you see here is just a small sample of the items that the Ministry of Foreign Affairs wishes to donate to the frontline workers, but also to those who do contact tracing and those who go into the communities to find the sick and the dying in our country. The Ministry of Foreign Affairs is donating today 300,000 pairs of protective gloves, 170,000 pairs of medical shoes that cover the shoes with which medical practitioners work with, 300 pieces of overall medical gowns, and 1,500 pairs of goggles to protect the eyes of the various practitioners. We are also very pleased because our embassy in Beijing has been working very closely with those who continue to wish us well. And from private companies and firms in China, we have received 6,000 N95 respirators, which are for masks for protecting the individual health practitioners, isolation gowns, 500 pieces, surgical face masks, 3,000 pieces, surgical protective suits, 500 pieces, thermometers, 40 pieces, and the normal face masks like what I am wearing, 85,000. Chief Administrative Secretary, this is how the Ministry of Foreign Affairs, which has worked with you in a very dedicated way since the beginning of this challenge, has come to show its solidarity, to thank you and through you to the Minister of Health himself and the Principal Secretary and all those who lead this ministry for the exemplary work that you're doing that has given many Kenyans great comfort in the times of this pandemic. We thank you very much, sir.
Thank you very much, PS. I want to say that we truly appreciate the gesture, the fact that this contribution, the one from the Ministry of Foreign Affairs, is actually coming from the Foreign Affairs Ministry and its employees. I think that is a wonderful gesture, and we truly appreciate it. We also want to appreciate the donation that is coming from the people of China through our missions and through the Ministry of Foreign Affairs. Indeed, we have received a number of large consignments of donations originating from China. I think most of us are aware that we have received at least 3 large shipments donated by the Jack Ma Foundation, which has provided the backbone for most of our laboratory testing, because most of the kits that we have used for a large number of the more than 30,000 tests that we have conducted have been using those manual kits from the Jack Ma. And we are aware that these donations are still forthcoming, not only from China, but from many other well-wishers. And again, I want to take the opportunity to thank all those who have supported the ministry and the government of Kenya in this battle against the coronavirus pandemic. We do appreciate your help. Thank you. Before we move over to symbolically accept the donation, our tradition has been that we field one or two questions from the media here. So, Mr. Mutua, maybe we can take 3 questions.
Evacuate people from neighboring countries such as Uganda, Rwanda, students who are in Africa. And then for Dr. Rashid, my question to you is in regards to prisons. We've seen a number of increasing cases of prison, people in prison contracting the virus. So is this an issue, and what are you doing in regards to stopping this issue?
Helen Aura, NTV. We've seen instances where people have managed to sneak out of certain counties and into other particular counties. Is there a breach in the security lapse, and do you purport it to be different? Because we know the government has said they've locked down and they've ensured security is up to speed or up to par, but we still see certain instances.
You may have to repeat that, Mutua, because I haven't got that question.
Oh, sorry. Mine is regarding security at the border points. There have been instances where we've had people sneaking into certain counties, and is there a lapse in the security checks at the border point?
Thank you, Mark Namasa from KTN News. My question goes to Dr. Aman. Nurses, today we are honoring nurses, but health professionals issued a strike notice for 18th of this month. How far have your negotiations gone on?
Some citizen.
My question is for Ambassador Macharia. We are aware that there's a meeting that has been called for players in the airline industry, and noting that this is one of the areas that has been worst hit since the outbreak of the COVID pandemic. Possibly, are you aware of this? Is your ministry also part of the team that will be going for this meeting?
Okay. So, Ambassador, let me answer my questions, and then I will I'll pass over to you. The prisons, and how are we working with the prisons, given that we have reported a number of cases, positive cases in prisons. I think I talked about this about 2 days ago or so. Prison environments are a high-risk area for us. We're concerned about the prison environment, and it's one of those high-risk areas that we have identified, that we are watching very carefully and conducting some of these tests that we are doing, the targeted testing. In this effort, we work very closely with the prisons department. We have provided prisons department, wherever they have health facilities, we have provided them with materials, PPEs, sampling material, and they have been equally trained in sampling some of these inmates. Together with the counties, of course, where these prisons are placed, we are collaborating both with the prisons department and with the county authorities to be able to monitor and test these prisoners, and then take the necessary measures to ensure that there is no spread in those environments. So we will continue to bolster their capacity also to be able to do this together with the county authorities. The second question was on the border points. As I said some days back, Kenya shares long borders with our neighboring countries, especially the border with Somalia. And that is one of the areas where we are seeing a level of concern in terms of people who either have visited Somalia for trade and come back and tested positive, or people who are coming in from Somalia. Equally, on our Tanzanian border, we have quite a bit of traffic coming in with truck drivers bringing in cargo, communities that live across the border and move freely between themselves. And many of our borders are porous too. The security forces are doing the best they can to mend these borders and to control movement there. But of course, people still use some of these porous borders. So we are now focusing on trying to provide and upscale the level of security at these borders so that we can also block off some of these porous borders. And the other measures that we have put in place is now the testing, particularly of those high volume movements of trucks and truckers between borders, Kenya, Tanzania, and largely mostly Uganda. We have put in place testing procedures for all truckers who are crossing this border. And I think we elaborated quite a bit on that and the guidelines that we have developed for that. So we are taking whatever measure we can to try to curb that cross-border movement and contain any spread of the virus across the border. Thank you. Ambassador.
Thank you very much. On the first question regarding returning Kenyans, I think you will all recall that we were very clear that the exercise in which the Ministry of Foreign Affairs was engaged in was an exercise of facilitating the return of stranded Kenyans who find themselves caught up in the lockdowns around the world. So far, we have facilitated, as has already been explained, 700. And we do expect a few more to trickle in over the next few weeks as the time goes by, as we find means and ways of facilitating their return. So I wanted to make that point, but also to emphasize that many Kenyans around the world are recognizing that it is important that they stay where they are, that they are best advised to remain where they're domiciled, especially when it comes to the Kenyan diaspora. So in the example of those who came from China, even though we have over 3,000 Kenyans in China, when the opportunity was presented for them to return, only 169 took the flight. We did not fill the aircraft. This shows you that even though people recognize that there is a danger where they are, but they recognize the inevitability of remaining where they are because life must go on, and many of them have lives to live, livelihoods to pursue, education to complete, and so they prefer to remain where they are. On the question about the airline industry, one thing we should realize is that every country has a different epidemic. All these global epidemics make up one big pandemic. And every country has to manage its epidemic differently because the circumstances around which that epidemic is unfolding is different. And in Kenya, our epidemic is unique to our country and unique to the fact that we live in the neighborhood that we live in with the countries that are around us. And so we have to manage it very carefully. There are countries that are beginning to look at the possibilities of opening up and lessening the circumstances or the restrictions that they have put in place. But many of these countries are regretting doing so because they have seen spikes in the numbers of people who are infected. And we are watching those situations carefully because we would not wish to repeat the mistakes of other countries. So whilst that decision is not the decision of the Ministry of Foreign Affairs, it is a collective decision of the Kenyan government, we, of course, provide a window to the world to share information with regard to what is happening in the rest of the world, and to make sure that that information factors into the decisions that are taken here in Kenya. The airline industry will not be an exception to this, and we shall share information accordingly. Thank you very much.